Tyrene, and they don't let her move for 1 week because they believe that the movements are provoking the dehiscence. In other centers, they put a Foley catheter because they believe that the urine produces the dehiscences. All those, I believe that there are excuses because actually the dehiscence is provoked by tension and devascularization of the bowel. If you do a nice anastomosis with a well-vascularized bowel and no tension, the patients do well. That's what I feel.
So, Dr. Pena, I have a rectoperineal to do tomorrow, and she does not have a colostomy. How long would you keep her? I'm going to do a full bowel prep, but how long should I keep her NPO after her surgery, do you think?
1 week, 1 week. Because, you know, the dehiscences, you know, the dehiscences.
It's a disaster.
Between 5 and 7 days. If you go beyond a week and you see that it's healing nicely, you most likely she will not have a dehiscence after that. So in some adult literature, they say that there is no difference in the frequency of dehiscences of colon anastomosis between bowel prep and no bowel prep. But what they don't say is when you have a dehiscence without bowel prep, you have stool all over the world, all over the place. And it's the worst experience that I don't expect you to have or anybody. It's really traumatic for the surgeon, for the patient, for everybody. And that's why we are extremely conservative. And we are living an era in which everybody tries to be brave and make it short time, save money to the hospital, make it simple, should no bowel prep and that. We don't follow that, but we are very proud of our results. And we sleep comfortable at night. That's very important.
That was a good and intense discussion. We're going to move on to the third case that will be presented by Dr. Georgina Blanco from Spain.
Hello. Hi. Good morning, everyone. Thank you for having my case.